Dr. Gabor Maté sat down recently with Prince Harry and they talked about ADHD and trauma. Let's hop right into today's topic. Prince Harry and Gabor Maté sat down to review his new book, Spare. And within it, he talks a lot about his trauma, his life, things that he's been through. And Gabor Maté, if you search YouTube, if you search other places, he talks a lot about the role of trauma and ADHD. Him and I differ on just some of that causal, because he pretty much says that ADHD is caused by trauma in most, if not all, situations. And I think the science is still really researching this. From different seminars that he's given, different things that he said, he believes that this trauma can be healed and that ADHD symptoms will go away. He is a medical doctor, and the way that I go about diagnosing ADHD is I do a detailed clinical interview and then I sit down and do psychological testing. There's also neuropsychological testing, which digs deeper into how the brain is functioning. And some people do need additional testing once we finish if there are some things that we're not completely sure about. ADHD and trauma can look a lot alike. And so let's talk about some of that overlap. I will be sure to link this article down at the bottom, but here there is a great infographic that talks about the overlap between trauma and ADHD. But there are some things that are separate, that some individuals have these trauma symptoms and then don't exhibit some of these ADHD symptoms, and then some people might exhibit symptoms of both. But just because somebody has ADHD, for me personally, it doesn't mean that they definitely experienced a trauma, or just because somebody went through trauma that they're definitely going to have ADHD. With that overlap, the symptoms that do overlap is that difficulty concentrating, being easily distracted, not listening or not seeming to listen, disorganization, hyperactivity, restlessness, and difficulty sleeping. But then there are some things that distinguish trauma that's not consistent with the diagnosis of ADHD, and then some things that happen with ADHD that might not happen within trauma. And Dr. Gabor is completely correct when he's talking about that with a trauma response, you're going to be on alert and you might pay attention to everything, which then means that your brain can't pay attention to the meaningful things. So, a child that's experienced trauma, that's in class trying to learn, that they might be easily distracted by classmates or other environmental things if they don't feel safe. And safety is required to learn. And this is where I did a video a while back, and I can link it down at the bottom, talking about safety within schools, that kids, in order to learn, they have to have a regulated brain. And that trauma activates our amygdala, that fight or flight part of our brain. And ADHD, traditionally, we're talking about the prefrontal cortex, but anytime that amygdala activates, it's going to shut down the prefrontal cortex. And once again, someone can totally have both of these things, but I do think that as we talk about these topics, that it's important to know some of the similarities and then also the differences. And if someone is concerned, that you do reach out to your doctor, to a psychologist, to a psychiatrist to talk about options. And Dr. Gabor, he's not a big fan of medication. I personally have seen people have benefits with looking at all their options, and they talk about that with their medical doctor. I'm a psychologist. I can't give medication advice, but I have worked with families that didn't want to take medicine and they did want to look at, okay, let's adjust these different areas and see if we can improve behavior. There's also a type of treatment called neurofeedback, and that is where a person does train their brain to pay more attention. Like, yeah, they actually hook up, I think it's an EEG. And if you want more information about neurofeedback, that is not my area of expertise. I can link some videos or some resources that might be helpful. But when people are looking for a non-medication option, that's normally what I recommend. I have worked with people that had history of complex trauma. And what we did was we tried to address the trauma first to see if some of the dysregulation, difficulty with attention, if some of those symptoms stayed. And then if they did, we went in for additional testing. The doctor did look at everything else. Especially in children, trauma can present like ADHD, but it's not, or there can be a little bit of both. I also wanted to share some additional resources talking about the causes and symptoms and treatments with ADHD, because there is this very complicated relationship between the two. Once again, talking about that overlap. And I will also link this one down in the description as well. And when we are looking at figuring out what's going on, often that amygdala, that trauma response is happening when a person is feeling unsafe. And for individuals that have experienced chronic trauma, complex trauma, they can feel unsafe all the time or even in safe situations. And so creating felt safety is incredibly important at home, at school, in all of these different environments. And I do like the hope that Dr. Gabor talks about with healing trauma, and that authenticity and connection are one of the greatest pathways we have to be able to heal these things. And if someone is looking for resources to find a therapist or to find a psychologist, I often talk about different questions that you can ask if you are looking for an evaluation, and then also just some different sites that you can try to find the right person. Please know that anytime you're in treatment that you can ask questions. And if the person is defensive or if you're not feeling seen and heard, you can try to give the person feedback, or you can try to see what other options you have. Lastly, I'll mention that I have a book, Turning Crisis into Clarity: How to Survive or Thrive in the Midst of Uncertainty. And when an individual is feeling incredibly unsafe, sometimes we develop things that helped us in our unsafe environment, but now we're continuing to do them even if we are physically safe, because safety is a feeling and it has to be felt. And anytime somebody doesn't feel safe, sometimes we have these different defense mechanisms that can come up that can try to help somebody get through a difficult situation. And so being able to practice mindfulness, being in the moment, in the body, that when I am physically safe, being able to feel safe, being able to connect with the mind and body in a healthy way, and also learning to regulate those emotions. That is all incredibly important for anyone's healing journey. If you'd like me to talk more about any of these topics, please let me know. Feel free to connect with me on my other social media, and I hope you enjoy the rest of your day.